So today I have arrived at the home of Dr. Nyla in beautiful Cheshire.
Hi there!
Hello.
Come in.
Hello Dr. Nyla, I'm here to ask you 20 questions. I'm a little bit early, but is this still okay?
Absolutely, come in. How are you today?
I'm really great, thank you. How are you?
Very good.
Can I ask, wow, this picture looks really interesting. Can you tell me the story behind this, please?
Yeah, so this is a really important piece of artwork which I actually commissioned myself. It obviously represents a typical rainy day in Manchester, but it's got my 3 ostriches which represent my 3 children. Something that I teach my children is that always stand up and don't be scared to be different. As long as you're not being ordinary or mediocre, be proud of exactly what you are. Come through.
Very inspirational.
So this is the main lounge seating area, and we spend as a family around 60-70% of the time in the kitchen lounge area. Can I get you a tea or a coffee?
Yeah, a cup of tea would be awesome, thank you.
No problem.
Wow, these bar stools look interesting. Look almost a similar design to the door handle.
Yeah, no, absolutely they are. So they're designed by a chap called Philip Watts, and actually they're quite unusual in that they're actually based on the silhouette of a woman's body.
I see.
I've always been quite artistic, and certainly I was very, very instrumental in designing the final finishing touches of this house.
Interesting.
Do you have any milk?
Yeah, no, that'd be great, thank you. I'm assuming artistry within your industry is very important?
Oh yeah, absolutely. So cosmetic medicine is not just a branch of medicine. It's so important to use your artistic skills. For example, a face, it needs to be continuous and flow, and each feature needs to expand into the next feature. The problem is when one feature is exaggerated and then it doesn't flow right. So it's so important that you have a really strong sense of artistry in cosmetic medicine.
Wow, that's an incredibly well-stocked fridge, Dr. Nyla. Do you cook yourself?
I wish I did. Unfortunately, as you know, I'm incredibly busy and I'm a working mum, so I don't have the time. However, we have a fantastic family chef, and she's really super organised, and she helps run this family. So here we have different labels depending on which day and whose food is what. So on Tuesday I have a green Thai curry, but the children have a halloumi chicken. So just being super organised helps us maintain a really good work-life balance, as well as eating really good, fresh, home-cooked food all the time.
Wonderful. I must say, Dr. Nyla, you've got a really beautiful house.
Oh, thank you so much. Oh yeah, of course you can. Come through. Come this way.
Thank you. Wow, Dr. Nyla, how do you always stay looking so fit and beautiful all the time?
Oh, it's really important to me to exercise, and so every morning I have a piece of equipment in here which is incredibly important, and it's my Peloton bike, and I do a minimum of 30 minutes every single day just to try and give myself a quick endorphin release, and plus it invigorates me for the rest of the day.
Amazing.
Please come through.
Dr. Nyla, tell me something positive and negative that you've taken away from COVID.
Well, something negative has unfortunately been the fact that my children have really been affected by it. One of my sons has gained quite a lot of weight, and unfortunately it's made him feel quite insecure. He's not been able to interact with his friends, he's not been able to do his usual physical activities, and I don't think it's been a nice time for the children mostly. Positive, definitely the fact is that I've been able to take some of my incredible skin tightening machines home, and I've actually been treating myself, so I feel like I physically look a little bit better coming out of COVID than I did going into it.
Dr. Nyla, tell me one hidden talent about you.
A hidden talent about me? Maybe that I can kind of play the piano?
No way, really? Dr. Nyla, can you play me something? Surprise me.
Oh, there we go.
Incredible. Dr. Nyla, can I ask you 3 true or false questions?
Absolutely, go for it.
Brilliant. 1, have you got £1 million worth of cars?
This is not true. I wish it was, but it's not true.
Okay.
I do love cars. I absolutely love fast racing cars, but no, I haven't. That's not true.
Okay. Second question for you. Have you had a facelift?
A facelift? Absolutely not. You could come and look. I've got no scars here.
Okay, fair enough. Another one for you. Is it true that you've adopted a baby?
I've got 3 children. There's definitely no way I need any more children.
Okay. Final one. Is it true you've got a private clinic in your house?
Now, so this one is kind of true. When people need that more kind of discreet service, we do have the facility to accommodate some patients. Do you want to take a look?
Absolutely.
Come through.
Wow, this is amazing.
Yeah, so this is just my private home clinic, which I can see some patients in.
Wow, absolutely incredible. Dr. Nyla, can you tell me the last time you cried?
Oh, the last time I cried? Seriously, do I need to answer this? It was probably when a patient came to see me and they had some quite significant scarring to the face, caused unfortunately by a beauty therapist who had been doing some cosmetic facial procedures on them. She'd had some lip filler put in, but obviously as a beautician you are not medically trained and you don't have a medical background, and unfortunately this beautician had injected directly into the artery of the face, which is the main branch of the facial artery, and given this poor lady a significant problem with the blood supply to her face. She's unfortunately ended up needing scar treatment, and it's really left her in quite a vulnerable place. And when she came to see me, it really affected me, because it made me think about how one human being could do another, be so brutal towards another human being when they have absolutely no medical skills. But I guess it just made me question a little bit as to what motivates people. But for me, I would have to be fully trained and competent and have the medical background to perform the kind of treatments that doctors and cosmetic doctors like me do have.
Wow, very, very impressive. Very interesting, Dr. Nyla. Can you show me your favourite room in the house?
So I've got a few favourite rooms, but to actually see my most favourite room, you're going to actually have to follow me upstairs, so come through.
Wow. Wow, are these your children on the wall in this picture?
Yeah, so that is Michael over there, and he is the fun-loving chap of the house. And then we've got Sophia, who's absolutely adorable, my youngest daughter, she's 7. And then we've got Adam, my eldest, who's a bit older. Yeah. So this is the room where I spend the most time. Come through. And it's actually the bathroom.
Wow.
So we have a huge bathtub, and it just gives me a bit of downtime.
Wow, incredible. Dr. Nyla, one question, a true or false one for you. Is it true you have over 100 bags?
No, absolutely not. I'm going to show you the proof. So just follow me and you'll see I definitely don't have 100 bags. So come through. I have definitely got 100 pairs of shoes, but I do not have 100 bags. Yeah, so I'm guilty as charged.
Wow, that's an incredible range of shoes. Dr. Nyla, what is your most favourite dress you've got in this room?
So that is so hard for me to choose, because as you can see, I've got a lot of dresses. Actually, the probably one that I love the most is what I wore to the Safety and Beauty 2019 awards, when we actually won Best Clinic of the Year.
Wow.
2019. So I love this dress just because it's got such amazing happy memories associated with it.
I've just got one final question for you, if I may.
Yeah, please.
Can you tell us what you've got planned for 2021?
So 2021 is going to be fantastic, because I'm finally getting the release of my skincare collection. So after years in the making, I finally formed medical grade skincare, which treats every cause and concern. I cannot wait to relaunch this with you and share this with you in April 2021.
Thank you so much, Dr. Nyla.
My pleasure. Thank you so much.